Hi everyone! Today we will be talking about understanding genetic testing for rare diseases. My name is Jonna Crocker and I am joined by my partner, Owen Harker. We are both students enrolled in BIOMG 1290, Personal Genomics of Medicine at Cornell University. Through this semester, we have been learning about many different facets to personal genomics. But at the end of the semester, we were tasked with creating a community engagement project, which would allow us to educate our community about a certain topic that we found interesting. We both wanted to understand genetic testing for rare diseases and be able to educate our community groups about this topic. Now, why is this important? Rare diseases are not as rare as you would think. There are, in fact, over 7,000 known rare diseases in the United States, and 30 million people are impacted by rare disease, with half of them being children. It also takes an average of 8 years and 10 specialists to receive an accurate diagnosis. And something that is very striking is that 30% of children with a rare disease will not live to see their 5th birthday. This places the emphasis on why it is so important to understand rare diseases more and also be able to effectively test and treat for them. But what does this have to do with genomics? Well, 80% of rare diseases are genetic in origin. With this project, we had a few key goals in mind. First, we wanted to help those in the rare disease community to understand genetic testing as a whole and also the benefits and limitations that currently exist with genetic testing. We also wanted to explain the difference between whole genome sequencing for rare diseases versus targeted genetic testing. Next, we wanted to explain GINA, which is the Genetic Information Non-Discrimination Act in the United States, and finally, discussing ethical dilemmas that may occur from genetic testing. Now, we wanted to start by explaining the different types of genetic disorders. There are 3 main categories. First is monogenetic disorders. These are caused by a mutation in one single gene. For example, sickle cell disease or cystic fibrosis. The second type of disorder is polygenic inheritance disorders. Now, these are caused by a combination of small inherited variations in genes. These often act together with environmental behaviors, so there's not one spot to pinpoint where the disease is coming from. Some examples include heart disease, diabetes, and autoimmune disorders. Finally, we have the category of chromosome disorders. These are caused by an excess or deficiency of the genes that are located on the chromosomes, or also could be caused by structural changes in chromosomes too. One example of this is Soto's syndrome. Next, we will be diving deeper into genetic testing companies, and specifically direct-to-consumer genetic testing companies. This means that these are tests that you can order yourself. You would be able to do the saliva test, send it back, and you would get the results yourself as a patient. These are not the same tests that go through a physician's office, as those are very different in their scope and the different research they do or how they conduct those tests. While there are 100 of DTC genetic testing companies, most will only focus on ancestry information, or sometimes they'll introduce wellness as well, but keep to the basics of those informations. So for our analysis, we really wanted to focus on the companies that prioritize healthcare in their results as well. The biggest company in this area is 23andMe. They offer 3 different levels, each with its own perks. The Health and Ancestry Service level is the most basic package, which will provide 10 plus health predisposition reports, carrier status reports for diseases like sickle cell anemia or cystic fibrosis, and a family health history tree. The premium package also includes pharmacogenetic reports, which actually tells you if your body is more or less likely to process certain medications. The total health screening also provides blood draw testing twice a year and genetics-informed clinical care with access to virtual clinicians. Moving on to nebula genomics. This has been ranked as one of the best tests for healthcare, but it's also more expensive. This company offers 3 testing packages, but only 2 of those are suited for rare diseases. This testing is for the entire genome or whole genome sequencing, which we'll discuss more in a little bit. Focusing on the Pro and Elite versions, which are suitable for rare diseases, they have a gene analysis tool to find variants, a genome browser to dive deeper into the information that's given, identification of rare genetic mutations, and up to 5 reports per month. The Elite version also has discounted genetic counseling, and the genome sequencing provides maximum accuracy in this Elite version. Finally, we have the company Sequencing that also analyzes the whole genome, and they specialize in rare disease screening. They say on their website that they have a test that looks for over 10,000 rare diseases, and also includes EDS, which is Ehlers-Danlos syndrome, which a lot of genetic companies will not include in their genetic testing. And you can see the prices and the different bundles that are available for all 3 of these companies. But ultimately, it is pretty expensive to undergo, but it could help you if you are looking for answers and are willing to do this on your own.
These genetic testings can provide a lot of information, such as one's health predisposition, which is if a variant in a gene is detected, it analyzes how much this impacts one's risk level for developing a condition relating to that change in the gene. It also can help estimate one's health risk, which estimates how test results affect the chance of a condition compared to no testing. This helps to estimate how strongly the genetic variant that one has is associated with a condition. Furthermore, one's carrier status can also be provided, which allows one to better understand, well, not whether if they have a condition, but if they have the risk of passing a genetic condition through carrying a gene down to their children. And of course, all these sites do give you access to raw data where you can search for genes, single nucleotide positions of interest, or even one drug response. There are 2 different types of genetic testing. There's targeted genetic testing and whole genome sequencing, and that can both have different pros and cons, but do help to provide some of that information I talked about before. Targeted genetic testing provides true, reliable results and can prevent the development of a life-threatening illness. And because it's targeted, there is a fast turnaround because only certain parts of the gene are tested, as you're going in looking for a smaller picture of the gene. However, it can cost hundreds of dollars per genes and only recommended for conditions that have accepted treatments and facilities for diagnosis, because it can be very difficult to learn this news when it is difficult to treat a rare disease. And this targeted genetic testing is in contrast to whole genome sequencing, which is the comprehensive analysis of the entire genome. And this tends to be better for complex symptoms where they don't point to a specific condition, something like diabetes, where there's a lot of genetic changes and variants that can play into impacting one's risk level. But there are many variants of unknown significance that can be identified, which can leave people confused and questioned. So there are ethical dilemmas in the whole genome sequencing. This can be called incidental findings, where certain conditions or genes are found that is not related to the current symptoms that one may be experiencing. Going further into other ethical dilemmas, GINA, which was passed in 2009, protects against the use of genetic information to discriminate in health insurance and employment. GINA prohibits groups and individual health insurers from using a person's genetic information in setting eligibility or premium amounts, and at the same time prohibits employers from using a person's genetic information and making employment decisions, such as hiring, firing, job assignments, promotions. And this also prohibits employers from requesting genetic information. Despite GINA protecting people against health insurers and employers, there are definitely a lot of limitations of this law, such as it doesn't prohibit medical underwriting by life insurance, which is based on current health status. And at the same time, it does not mandate coverage for any particular medical tests or treatments. And it also does not prohibit workplace collection of genetic information for monitoring programs, wellness programs, or the administration of federal and state family and medical leave laws. In summary, GINA is designed to protect patients, and comprehensive family history is protected, and the law does not compel physicians to order genetic tests that they would not have ordered otherwise. And at the same time, health insurance companies cannot consider genetic information as a pre-existing condition.
Thank you, Owen. Now I will be talking about some of the other ethical dilemmas that occur with genetic testing for rare diseases. There are a few ethically gray areas when it comes to genetic testing. The first is the impact on family. If a condition is genetically dominant, that means that an individual's parents, siblings, and children might also be impacted directly by the results. But the question is, should family members be informed of these results, and did they even want to know in the first place? Another area of concern is with privacy. Genetic information may be shared with third parties like employers or insurers unintentionally. And even though GINA exists, there is still fear of discrimination. And in this category also falls unknown data protections. And while we believe that these companies, especially the DTC, genetic testing companies, are secure, we don't know what would happen with a data leak or how your information is truly being protected. And finally comes the emotional burden. A lot of times with rare diseases, you will receive results that include variant of uncertain significance. This can often leave you with more questions than answers and not really having a plan to move forward. And also, while it's good to understand the diagnosis, many rare diseases are still focused on treating the symptoms because they don't have a cure. So let's summarize what we talked about today. First, we learned that 80% of rare diseases are genetic in origin, making this a very prominent discussion. We talked about the 3 types of genetic disorders: monogenetic disorders, polygenic inheritance disorders, and chromosome disorders. We then talked about a couple of direct-to-consumer genetic testing companies that are available in the healthcare space to learn more about your genetic results. We talked about some of the benefits and drawbacks of these, as well as the pricing options and what benefits you may be able to receive from those. We also talked about what information you get, such as your health predisposition, certain health risk estimates, carrier status, and raw data that then you could use to go and plug your genetic results into other sites or learn more information. We talked about the difference between targeted genetic testing, which is often for one or several genes, versus whole genome sequencing, which goes across all your genome for mutations, except there are often variants of unknown significance, or you may find incidental findings that you weren't expecting. Next, we talked about GINA, the Genetic Information Non-Discrimination Act, and the ways that it protects you, but also the limitations that it has. And finally, we talked about some ethical dilemmas with genetic testing, including the impact on families, privacy concerns, and the emotional burden of genetic testing. Now, we would really appreciate your feedback on our presentation. Please complete this survey. It would only take you 5 to 10 minutes. And this will help us to understand if our presentation was helpful for you or if you have any remaining questions about genetic testing that we can either answer ourselves or find the answers and get back to you. Thank you so much.